All right, so I'm going to move on to our final topic today. And so I'm going to do just a general medical topic, which I like to do from time to time because we don't always talk about plastic surgery and health sometimes, or plastic surgery and beauty. Sometimes we talk about health stuff. And you're going to know about this because today we're going to be talking about stroke and recent trends in stroke deaths changing over the past 20 years. So stroke, fifth leading cause of death behind. You guys know it's ahead of stroke. I bet you guys can nail almost all of them. I know you hate it when I put you on the spot. What's stroke's number 5? Name one of the top? You guys can name one, right? You each name one. I'll name the other 2.
Heart attack.
There you go. Heart disease. Trey, you got one?
I do not. Cancer.
There you go. Yeah, I knew you guys could do it. That's number 1 and number 2. Great
there
work,
we go.
Guys.
There we go.
Number 3 is accidents. Number 4 is still COVID, which I didn't believe that at first. And the thing is though too, like the data is always like a year or two behind. So, I don't know if COVID still is that high today. But as of the time that the data was, COVID was number 4. So stroke comes in at 5. And there's a new study that came out this month showing a big change specifically in stroke deaths. It came out in the PLOS journal, which was work from Georgetown and University of Washington. As always, I'm going to throw that study up there if people want to go look at it. Trey can toss that pick up. There's the study if anybody wants to check it out, but I will summarize it for you shortly. But first off, what's a stroke? You guys know what stroke is, right? Mm-hmm. Okay. Well, not everybody knows. So stroke basically occurs when the blood supply to part of the brain is interrupted, which obviously is a bad thing because you start to get cellular damage and eventually cellular death, which makes this a big medical emergency. There are 2 types of stroke. There is ischemic stroke and hemorrhagic. So ischemic strokes are far and away the most common, makes up about 90% of strokes. And that is when a blood clot or a plaque or just very low blood pressure just blocks or prevents blood from getting to your brain cells. Mm-hmm. The other type is a hemorrhagic stroke. This is much less likely. This is where the blood vessels in the brain actually burst. You guys heard of aneurysm? Mm-hmm. So like if you blow an aneurysm, that's a hemorrhagic stroke. So symptoms of stroke, we probably all heard these. They're typically sudden onset, things like numbness and weakness in the face, leg, or arm, which is usually one-sided, but not always. Sudden confusion, sudden inability to either speak properly or understand speaking, vision changes, dizziness, coordination loss, severe headaches. So those are the symptoms of stroke. There's a couple sayings regarding stroke in medicine because quick treatment of stroke is critical. So the 2 you always hear is time is brain, which basically means for every minute that clicks off after a stroke starts, brain cells are being lost. Mm-hmm. And the other one you hear is the golden hour, which means that when someone has a stroke, ideally you want treatment to be started within an hour, which is hard because, people aren't stroking out in the emergency room. They're having a stroke at home or at the ball game, and then you got to get EMS to get them, and then someone has to figure out what's going on, call the right people. So, it's actually kind of challenging to start treatment within an hour. But as I said, every minute that goes by, every minute there's like millions, 1 to 2 million brain cells die. Fortunately, we got lots of brain cells, so you can lose 1 million or so and still probably be all right. But you do want to get it taken care of as soon as possible.
Do brain cells come back? You can't grow those again, right?
Yeah, not really. Like nerve tissue is like the one thing in the body that does not really regenerate once it's gone.
That's what I thought.
Yeah. You can get limited amounts of regeneration, but not really. Like so, for example, when nerves get cut, you can repair them, and the nerve distally dies, and it will kind of regrow, but it's never kind of the same. Brain cells are even less likely to come back. I mean, if you have a stroke and you lose a bunch of brain cells, I mean, it's
I have dark spots in my brain from the seizure I had.
Really? Mm-hmm. They can see them on CT?
There. Yeah.
Interesting.
Yeah.
Well, you're doing very well.
Yes.
It hasn't affected you that
much.
Did it change your personality?
I don't know. I don't know. I didn't know if it was I
didn't know you before then, right?
No.
This is before.
It was a long time ago.
Yeah, okay.
It was before I had Avery. So it was over 11 years ago.
Yeah, very good. So treatment, how do you treat a stroke? Well, number 1, you want to restore blood flow to the brain. This is done by several methods. Thrombolytic, so if the stroke's caused by a clot, like a blood clot, then you can give medicines which break down clot. The other way is endovascular, so you can actually fish a little wire up the blood vessels and like remove like a plaque, which is you can't break down plaque with thrombolytics, so you could do that. And then finally, there's surgery that can be for really large clots that couldn't be broke down with fibrinolytics, or say for example there was a bleed and you had to go in and repair. Of course, that's brain surgery, which that's really big stuff.
Can they put like stents in your brain like they do your heart?
Yeah, I imagine so. I mean, that's actually a question I don't know 100%. I'm sure they can if you had like a vessel. The problem with the brain is that, there's a lot of twists and turns. And so I don't know how good that they are with those wires. And I don't know how far they can get up. Like that's getting into knowledge that I'm just like, I know just enough to be dangerous about. Like I know they can run wires up and do things, but the extent of what they can do is a little unknown to me.
Yeah.
But yes, they can do certain things, and I'm sure stents are some of them. It just depends on where it is.
Yeah.
Because as you go further and further, and you start to go like this, eventually the wire won't go. So risk factors for stroke. So there's modifiable risk factors and non-modifiable. So modifiable risk factors would be like high blood pressure, heart disease, diabetes, cholesterol, smoking, alcohol use, obesity, atrial fibrillation, and oral contraceptives. So those are things you can change. Non-modifiable risk factors are things like older age, race, African American race, higher risk of stroke, gender, men, higher risk of stroke, having a stroke in the past, or just family history.
Yeah. My grandfather had a stroke. He was bedridden for the rest of his life.
That's what my mom ended up having this year.
Yeah.
Yeah, that's terrible stuff. So what is this study? What did the study say? Well, I did a deep dive on the study, looked into it, and it basically was talking about the changes that have occurred over the past 20 years. And some of them are kind of noteworthy and others are kind of like, So starting in 2009, the rates of stroke deaths started to go up. And that was after years of going down. So that is notable. It's like, okay, why are stroke deaths increasing? And we'll kind of do a discussion at the end. The other thing is that from 99 to 2020, patients who died at home from stroke rose dramatically from like 8% to 29, and those that died in the hospital went from like 48% down to 29%. So where people are dying of stroke is changing. Again, we can talk about that. Rural Americans are much more likely to die in nursing homes or long-term care facilities versus hospital versus those in the city. That kind of digs into what is available and what location. It makes sense. There's less hospitals in rural America. African Americans had the highest death rate in hospitals, which makes you want to dig into that information to see, is there something that we're missing? Why is one population having a worse outcome?
Yeah.
And then Caucasian people had the lowest hospital death rate, but the highest death rate in nursing homes and long-term care facilities. So again, what does all this mean? Well, so starting first with the increase in stroke mortality, it's probably due to risk factors increasing, because you can look at things like high blood pressure, obesity, heart disease, and if you see those things going up, then you're going to see an increase in strokes and strokes deaths. So, the authors basically said, okay, well, it's not like that we're doing something suddenly wrong or there's something, malicious going on. It's that the risk factors are going up, and when those factors go up, then strokes go up. As far as like people dying at home versus hospitals, that's probably due to the rise of things like hospice care.
Okay.
Hospice is a somewhat new phenomenon, or at least an accelerating phenomenon, where when people get to the end of life, they're not just putting them in the hospital until they die, or in a nursing home. Like you can go home, you can be at home, and people will come.
Like a home health.
Yeah,
nurse.
like a home health nurse, a hospice nurse will come out and make sure you're comfortable and make sure things are not going off the rails, and it's a good thing. I mean, I don't know. I think I'd rather pass at home than in a foreign place.
Yeah.
And so I think hospice is, a good thing for those that need it. And I think that this study is really seeing kind of the change in end of life care and reflecting that. So I don't think it's a bad thing. The increase in African American deaths in hospital. I mean, we know that African Americans are more prone to stroke, and some of that's related to risk factors. Some of it could be genetic. I mean, certain ethnicities just have genetics to be more predisposed to certain things. I mean, we know that. And so, I think with this, the main thing is to make sure that there's not like a lack of care. that there's not some, deeper issue with that.
Yeah, I think the key is always prevention. With
Yeah,
those
100%. Yeah, I mean,
we need to pay closer attention.
I think a lot of people aren't aware of like all the risk factors for stroke, and so a lot of them are things you can change, and so I think the study, honestly, I don't think there was anything groundbreaking in this study, but it's a good kind of reminder about, hey, stroke's one of the major causes of death in the United States, and these are how things are shifting, and I'm not sure it's as helpful as patients as for doctors.
Yeah, it's important to get a primary care doctor and
and then knowing
normal visit.
Right, absolutely, for the patient that's critical. Like get into a doctor and say, hey, what are my risk factors for stroke? I mean, it's the fifth most common.
And like getting your blood work done, taking your blood pressure, doing all those
keeping your
like,
blood
little
pressure
things.
down. Make sure your heart's healthy. Keeping cholesterol down. Because cholesterol builds plaque, and plaque causes can cause strokes. So I think that this study didn't have anything early earth-shattering, but it's a good reminder that stroke still is a major cause of death and morbidity in the United States, and we need to keep on top of it. Keep up the prevention and try to prevent as much unneeded death and illness as possible. Yeah. So, all right, I think that's about it. I don't got anything else important to say.
Me either. I'm ready to go to Mexico.
I bet you are. I bet it's hard to come here today when you probably should be packed. Thank you, Sarah, for coming.
I have to write 2 papers too.
Oh my gosh.
Finish writing 2 papers for.
There's something that can help you do that.
Yeah, but you have to turn those papers now into turnitin.com, which reads to make sure that AI didn't write it.
Do you want me to tell you how to beat that?
Sure.
Okay, if you want to beat those detectors, first you write 10 papers, and then you plug those into AI and tell it, this is my writing style. I want you to write something in this writing style with no variation. And it'll do it.
Well,
I taught my daughter that trick. Now, I don't let AI write for me.
If my professors are watching this, no, I will not be doing that.
Yeah, Sarah's not going to be doing that. But that's the way you can beat those.
Interesting.
I have a lot of good information.
You know that there's like a lot of like software, like websites that are like getting people to pay them money to detect AI and then to rewrite it for them.
AI is just...
But they rewrite it in like, it sounds like a child wrote it. And like
it sounds like a child.
It's like weird.
Dude, AI is spawning so many new businesses. It's like when the internet came out and everyone's like, oh, this is cool. And then suddenly there's 10 million new businesses related to it. It's AI, man, I'm telling you. We're on the forefront. You and I, and Trey too, we're all on the forefront of this. We could do like an AI podcast. Sure. Trey laughing. He's laughing at me there. All right, we got to wrap it up. All right, you guys, thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Leave us a comment. We want to hear from you. And maybe we'll do a segment on a topic you want to hear about on the next episode of Nip Talk.
Bye.